Are we good to go, Liam?
Yes, ma'am.
Okay, first of all, you guys, I'm so sorry we were late. Like I said, we took a field trip. We went the roundabout way. We did some really cool, not so cool
We're
things.
trying to find station 61.
Yeah. It's 10 stations away from this one. Yeah. So my name's Darby. I'm one of the flight nurses, adult flight nurse with LifeFlight. Pam is also one of our adult flight nurses as well as our education person for our entire LifeFlight.
Yes, indeed.
Pam and I started this program, started taking off about a year ago, getting the understanding that we wanted to do this program, and by the time we presented it to the big guys, it took us about 6 months to get it off the ground and get it started. So that was pretty awesome. Nothing moves that fast anywhere except for this program, I guess. All right.
It just goes to show the support from the community
William?
and for the EMS
Button circle,
world.
left and right. Yeah, it's like there's no arrows, they're worn off, but
Might be wrong.
there you go.
There you go.
Fancy. Okay. So this will be super informal, you guys, so interrupt me if you have any questions. And we'll just go from there. So, history. So some of the background for us is Pam and I both went to two separate conferences. Mine was in Salt Lake, yours was
Florida.
Florida. We came back, we had a step out program with those guys that was a canine casualty care course. And so we thought, okay, that's pretty cool. And then we found out that people were transporting canines that were injured in the line of duty. And we're like, why are we not doing that? So when Pam and I both got together again as we came back to Utah, we're like, okay, we probably should start this. And so start this, we did. Implement this, we did, and here we are. A little bit of history about the canine program. There's, as you guys are very well aware, there's not a lot of training for first aid. There's not a lot of support for first aid for our canines, and that's unfortunate, and we're trying to change that. Since Pam and I have started this, we've had two different companies, flight companies, call us, one from Tennessee and one from Florida, and we're starting to help them get their programs moving forward anyway. History of it. So 2016, we started doing, not we, but the US started doing some casualty care courses, started to be developed. They provided education on wound packing, poison control, CPR, and tourniquet use only. Herman Memorial LifeFlight out of Houston was the first air ambulance to start transporting wounded canines, and they have transported, I think, 3 or 4 up since their program started. The second program that started is in Boston, Massachusetts, and we are the third program nationwide to start a canine program, so that's pretty cool. The individual first aid kits needed to be provided for handlers, but they were provided for the human more than they were provided for the canine. So we're in the process, our next project is to start making canine first aid kits that we can distribute to the community so that they have something that's very specific to their canine. And we'll ask for some feedback on that as we go through this. There's so many agencies out there that do so many different things with our canines, whether they're search and rescue, they're AVI dogs, whether they're SWAT team dogs, it doesn't matter. We want to make sure that those first aid kits are applicable to the job that they're doing. So if I need forceps because I need to get thorns out or I've got porcupine quills that shot me in the face, then I need forceps. But if I'm in the urban area, I'm not going to need that. I'm going to need something else. There's the chances of a porcupine being on a SWAT situation, probably not real strong. So we'll make those first aid, I mean, it could happen. Anything happens in first responder world. Anything happens. But anyway, we're going to try and make them where they're user-friendly for different agencies and put the equipment that they need in those kits. Okay. So the reason why we started doing this one, Pam and I went to the conference, we're like, okay, we have a lot of underserved animals in our area. We have a ton of operational canines in the state of Utah. I don't think we even knew how many operational canines we had, and then they're like, oh, 100 or so. Okay, well, we've trained over 100 already, so I think we're well into 500s, probably thousands, as it keeps getting bigger and bigger. So underserving our area, we decided that's a problem. We lost a local canine, Maya. That was a big loss for us. That happened a year ago in February. And no, we don't have footage of this, but if anybody's ever been to Taylor Longmore's presentation on that, the body cam footage is quite awful. It is a process of what do we do how can we help? And it was, for me, it was gut wrenching because all you want to do is help. And they didn't have the support they needed for the help that they needed at the time. And then I think we've already talked about significant number of canines in our area. We have limited canine education, and we're trying to fix that. So the people that are involved, this was kind of a big deal. We had to start from the very bottom. Didn't know how to do it. There was only a couple people in the United States that were doing it, so we didn't have a lot of direction. But we decided we better start with a medical director. We chose Dr. Laura McLean. Some of you may know her, but she is our medical director for our LifeFlight program. Jeff Simmons is out of Mountain West in Layton, and he is supporting his whole community, supporting us, their vet centers community. I mean, it is crazy how much support we've gotten, you guys. Holly Doherty is out of Sunset Med Vet, and Jordan Shirk is out of our Salt Lake Med Vet. We do have a couple of pictures and stuff in here, and we'll show you. We've been able to do mock transports at these two facilities. They went very well. We haven't been able to get over to Mountain West yet, but we've been told we can't land in their parking lot. It's pretty cozy in there, and it just doesn't give us a lot of room. We're going to land in the street. That being said, the Layton police officers said that they don't mind inconveniencing people. We will shut down the road that's adjacent to the
It's
hospital.
the main street, yeah.
Yeah, I
it's
don't know
main.
what the road is,
Northbound
but
Main Street.
Yeah,
they will shut it down. They don't mind inconveniencing folks, and we will make sure that we land safely and we transport that canine. So that's where we will land there. And then we've already talked about Pam, myself, and then if anybody knows Sam, he is one of our medics, and he's been to New York. He's done a ton of FEMA situations where he's operated with canines as well. And so he's our third person.
It's probably his dad. His son used to work here.
That's Sam, that's Sam.
Oh, and
Yeah.
that is
That's
Sam?
Sam.
That-
he-
yeah,
he
it's
used
our
to-
Sam.
He
He's
used to work
young.
here.
He's like 12 years old.
No, he's not.
he's having a baby.
He's married and expecting a baby, or he
We
would be
know.
here too.
Yeah,
Yeah, he's
I mean, he
pretty
does
young.
look 12, tall 12, but yeah.
And we keep telling him that he manages to come up with excuses to not go to these teachings. And so next time we have to have a television presentation, he's up. Pam and I've done ours. I'm a big fan of the baseball, and so this kind of fits into my slide. If we build it, they will come, and that is exactly what we've done. We got it out there, we started spreading the word, and the word spread faster than we could keep up. It was like a forest fire. So there we are. Operational canines. These are not the purse puppies that we're carrying around town. We're not taking care of those guys. They can take care of those guys themselves. We are taking care of our dogs that are working dogs. So canine officers, search and rescue canines, AVI dogs, fire forest service, the line we kind of thought that this was going to stop here,
Yeah.
and then they called, and then they called, and then they called, and they called, and the list, I mean, I could probably put the list all the way down to the floor, how many people have called us to ask for first aid education, how can we make this happen, how can this be better, how can we get involved? And so that list keeps growing and growing and growing. And at first, Shelby has helped us a ton, comm centers, we were all like, what do we do now? This is so fast. So it's gonna keep growing, you guys, and I think it's a great thing. Here's some of our perfect patients. If anybody knows Kate and Gabe from Utah Task Force, and they also work with FEMA. This is Rita, Swayze, and Redford. They'd helped us train the majority of our staff as our guinea pigs, and they have been everywhere with us, to the point that when they walk in the hangar, they're like, oh, cool, I know this place. They've been there so much. So special thanks to those guys for helping us so much. And we'll kind of go over this, but this is what the aircraft, when we go outside, you guys, if we have to transport a canine, that's what that's gonna look like. If that canine is critical, they're gonna be laying on that stretcher, they're gonna be wrapped up in that blanket, and they're gonna be seat belted down. We're gonna be protecting their airway and stopping bleeding, whatever we need to do at that point. If we need to measure breathing tubes, this is what that looks like for us, and we'll also show you another way to measure those. And then the mask, or the muzzle that we have, we can put a nasal cannula into it, and we'll tack that down with either, some people, military-wise, they're tacking them down with zip ties. We're gonna just use medical tape, because we're gonna reuse them as often as we can. Let's see, canine rescue transport. How do we do it? So we trained all of our staff, and initially we started training our staff based on a volunteer. Hey, do you want to volunteer? Do you not want to volunteer? It wasn't mandatory, is what we didn't do. 90% of our staff volunteer to participate in this program. And every time we onboard somebody else, they're like, absolutely, let's do it. So we've gotten no pushback from staff, anybody. We had IA Med come out, which is now Impact EMS. They came out and did a lot of education for us on our canine education, our medical first aid. Then we started getting equipment for the helicopter. Because, and you guys will look at this, that's an 11, and this is what we'll use on the majority of our dogs. It doesn't have anything to do with the Nair situation, it's all the dead space that they have between their trachea and their bronchus when it comes all the way down, because they have a lot of dead space through here. So we didn't have that for a human, it actually says on the paper, do not use on humans. If I don't like you, I might use that on you, but we'll see. So we got all that, and then we have 5 emergency hospitals, and we're still growing as that develops. Jeff Simmons is putting together a new vet facility in Bluffdale?
Yes, Bluffdale.
Bluffdale.
Is that the 5th one?
That is the 5th one.
And
we also
there's
have
one in Las Vegas now.
Yes.
Because there's nothing south of Salt Lake County.
So
So,
we-
yeah, go ahead.
We want to transport, so our Cedar hospital, or our Cedar team and our St. George team, if they need to transport any canines down there, they'll transport from there to Las Vegas. That's the shorter flight for them. So, like I said, just growing. And we have a couple hospitals here that we can't get a helicopter into, but they want to participate. And so we're giving ground referrals to them. If you're close to them, they will take you. They have the resources that you need. As far as blood, surgical intervention, what you need, we just can't get a helicopter anywhere close to them, so. And we'll provide those for you as we go. And talked about our medical director. We have patches for everybody to put on your canines. These guys right here. Shelby and all of our comm center did a really good job getting the information out.
Medic Engine 51. Respond to 31 Alpha, unconscious, at 8:15 West Antelope Drive, in Layton. Medic Engine 51. Respond to 31 Alpha, unconscious, at 8:15 West Antelope Drive, in Layton.
That gives me chills.
When someone's got, I just feel like I need to run somewhere, right? Anyway, so big question everybody asked us is when we call and we need help, who do we call? Like, am I calling just regular dispatch? Not everybody transports canines. And so Sam came up with this patch and we're like, that's a great idea. Until our comm center could talk to every person possible as far as getting the comms out there. To make sure that if you guys call, even from your own radios, if you dispatch us and you need us to come for a canine, that you're gonna get the appropriate service to come to you. In the event that you can't get any contact to go through, those patches have the phone numbers on them, so we suggest you keep them with your dog, on your stuff, whatever. A lot of our handlers are keeping them just on their vest so that it's right there with them. That's a direct number for us there. If you wanted to put that in your phone, we suggest saving that. It's also the one that's on the patch, and that will get you to us if you need help. Dispatch and tones. So I just kind of made this.
Do you want Shelby to go through the dispatch process?
Oh, yeah. You can do that?
Sure, do you have a slide for it or? am I
Nope.
making it?
Nope.
Yeah.
This is ad lib right here, sister.
All right, so the number, like she said, the number on the patch comes straight to LifeFlight Dispatch. You can either call us, you can call your own dispatch. We know that's usually your habit is when you need help, you call your own dispatch. Either way, I've got around to, I'm not gonna say all because there's probably something that I've missed, but I've got around to most all of the dispatch centers and told them that this is a program we've got started and this is what we're doing. For Layton dispatch, I've given them an actual map of like, okay, our number 1 spot, this is where you want our northbound lane, close off all the northbound lane and all. So all of the different dispatch agencies will know what the process is for when we need it. We as LifeFlight will need someone on scene to be our ground control, make sure they've got that LC secured and set up for us. So when someone calls in, if you're, let's say you guys are calling us direct, the things that we're going to need from you guys, we wanna know your name and your canine's name, and then what injuries you have. That way we can tell these guys, so as they're en route flying to it, they know what okay, we're gonna need this, we should grab this bag, we're gonna need this piece of equipment, whatever you can tell us about the injury and mechanism, so impalement, where it's at, abdomen, upper, wherever, so that we can relay that information. So your name, canine's name, injuries, mechanism, and then location. Whatever you've got for us for location, we'll take it. We can take GPS in any format, doesn't matter what you give it to us in, our program will recompose it into what the aircraft needs, so we can take that, we can take an address, if you're an address, we can take that. And then we will update, we won't most likely be calling you guys back and giving you ETAs, because we know that you guys are gonna be hands-on doing what you can to your animals, so whatever county service you're working for, we will be calling your dispatch center and saying, hey, we got a phone call, we're headed to such and such location for this officer and this canine, and give them our ETA so that then they can relay that information to you guys over the radios to the bus train to run you through phone calls and that. And then our next phone call after we've got our team up and going is our next phone call is whichever of our emergency vets that you're closest to, we're gonna be giving them a phone call and giving them that information, and they will use your name and your canine's name to start a chart on it so they can have everything ready for you guys to show up, and then we give them an ETA, so they anticipate, okay, they'll be here in about 20 minutes, and then when our aircraft lifts, we call them back and give them another ETA, hey, they've lifted, you should see them in 2 minutes. So we're doing that, plus when we talk to your dispatch center, getting that information, we're getting them somebody to the scene to be able to secure the LZ for us. So, a lot of moving pieces to it, but we have, all of our, in dispatch, we have, just like you guys, there's a protocol written for every single thing that you can imagine. And then we discover ones that nothing's written, so we do pretty good at that, but we have a process written for all of it, so it doesn't matter who's on for the day. Everybody in dispatch knows and has been through the drill and practice what's gonna happen if the opportunity happens that we need to go and help you guys, so.
Thank you, ma'am. You say it so much better than I do. So here's the hospitals, you guys, and these are what LZs are looking like. So if you do have to help us control the LZ, this is what they look like and where they're at. This one is at Sunset MedVet. There's tons of room right here for us to land. There's tons of room for us over here to land. When we did our mock transport here, we had vehicles here blocking the entrance. We had vehicles over here blocking the entrance. Totally safe, not a big deal. When we off-boarded the aircraft, we can go back through these doors right here. That takes us in the back door of the ER. So we do not have to go through the main lobby. They'll go straight in and triage through the back door. This is Mountain West. That parking lot, those lights, all those trees, all those cars there makes it virtually impossible for us to park our helicopter there. So that is not where we're gonna land. We're gonna land in the street. This is Sunset, it still makes me laugh.
Salt Lake, yeah.
This is Salt Lake MedVet. We landed like right there. Every time the blades spun, the automatic doors opened. So everything that was outside was now inside.
They literally had a leaf blower after.
We had to
and
get a
they'd
leaf
blown
blower, we had to
the
go in and clean up our mess, and it was kind of funny, but we decided we're gonna park a little further back so we don't have to do cleanup afterwards.
And with all of those spots, like Deborah said, we've gone out to all of them,
Yes.
done the practice landings at all of them, and so we have a primary and a secondary preferred LZ spot at each of those spots, so you guys get there, whoever it is that's coming to set up the LZ, if the first one looks like garbage, we 100% are gonna trust what you guys say, okay, find us a secondary, and
Yes.
we'll land wherever you guys have chosen for a secondary, so.
And if you're new to LZs, like the Sunset PD was, and they were picking on the new guy, and they're like, just stand right in the middle where they should land. Okay, no, that's not what don't stand in the middle, because we need to land in the middle. They picked on that guy so bad, I felt so bad for him. He's like, and they're like, move, move. So anyway, don't stand in the middle of the LZ because it's going to be hard for us to come down. ABCs, D, a little bit different. We're not defibrillating, we're dispatching. So we'll go over airway, we'll go over breathing, circulation, and dispatch. Today we're going to talk about some restraining, some muzzling, which is the restraint that we need them to have. We'll go over some assessment, airway, nose to snout breathing, oxygen, combat gauze, tourniquet application, bandaging, splinting, CPR. Most of you guys have first aid, so this is going to be pretty basic for you. except for some of the canine specific stuff. That's gonna be different. So restraints, a little bit different. And we'll go over them as well. So standing, you can do a kneel and a wrap around their chest so that they can't move. That's gonna be the position that we need to do the assessment in. So if they're not critically injured and they're still sitting up and we need to do an assessment, you can either hold them and kneel on the side of them and hold them this way, and we can do the head to toe that direction. We have an IV restraint that we can do. That's basically them sitting, bringing their arm out, twisting so that we can get that vein popped up here. And then lateral, not the best position for anything because that canine's sick. If they're laying on their side and they're not fighting back at us, they're sick, they're hurting. So we want to avoid those if we can. I put this slide in there. I don't know if it's very important, you guys, so don't get hung up on the dorsal is the back, the ventral is the tummy, the caudal, the tail, don't worry about it. If your canine is injured, right, left, chest, face, we don't care, just say that, because we're gonna be able to decipher where your injury is at. So if you tell me left chest, if you tell me back, I'm gonna know back. If you tell me stomach, I'm gonna know stomach. You don't have to say they're injured on the ventral side. I'm actually gonna probably take this slide out, so I would ignore that. Vital signs. Normal vitals for our canines are 100.5 to 102.5. Their pulse is 60 to 80. Respiratory rate is 10 to 40. They do have a controlled pant, which is normal, and you will think that they're breathing faster and less normal, but that is good for them to cool off. Their mucous membrane should be pink, and their cap refill should be less than 2. March. How many know March? Like everybody. Perfect. Okay. March is a little bit different with our canines because we have 3 M's, and we'll go over those. Otherwise, it's the same. It's the hemorrhage, the airway, the breathing, the circulation, and the hypothermia. The M3 stands for we need to move to cover. If you're in a SWAT situation, we cannot come into that area. That is a hot zone. We cannot come in there. You have to bring that canine out to us. Once you bring that canine out to us and you make sure that we're safe and the aircraft is safe and everybody is as safe as we can be right there, we're going to start doing canine support at that time. We also ask our search and rescue dogs, these emotional dogs, they're not aggressive. Some of our police canines, you put a muzzle on them, they start punching you. And that's not fun. So we're going to want you to restrain them and keep their face away from them. We're also not going to put them in an aircraft without a muzzle. Any canine that's injured, we're going to put a muzzle on them because they're hurt. And the very first thing they're going to want to do if we hurt them is bite us. And so we're going to prevent that from happening because they're not doing it on purpose. They just don't want us to hurt them. Hey, they can come in. And then we're going to control the bleeding. That's going to be our biggest point of what we need to do here. I see the injuries that we will take care of are going to be a penetrating wound or a heat illness. Because we have a lot of search and rescue dogs here and they hike a lot of mountain terrain. And so I do think heat illnesses are going to be a big problem for our canine population. We'll talk about some hemorrhage control. We're going to show you some different applications for tourniquets and devices that we're going to be using. You can see this guy has a field muzzle on. If you guys are hurt in the field or these guys are hurt in the field, almost every handler I know has a field muzzle in their pocket or some sort of muzzle that they can put on. In the event that you don't have a muzzle, don't worry, we have some. And we can also do a field muzzle, or you can do a field muzzle out of Curlex. So we'll show you how to do that as well so that you're not getting bit and they're not. This will be the one that we use in the aircraft. If they have an airway situation, we can use this. We can put the non-rebreather over it like that. We can also put a cannula on that. If we're not there yet and all you have is this, please use it. Just put it around their muzzle and their snout and let them get as much as they can as blow-by. 4 P's for bleeding control. We're going to probe, we're going to pack, we're going to pile, and then we're going to apply pressure. No human blood products, no albumin, and no other animal products can be administered to these guys. We just can't do it. Dogs are high risk for anaphylaxis, and that's why we can't do it. They're also, we have blood at every single one of our facilities, canine blood. It's there, it's available. It is the craziest thing. I think we're all blown away when we walk through some of these hospitals because to me, grew up in the South, everybody has a beer fridge. everybody has a beer fridge. I know that's not a thing here, but that's exactly what it looks like to me. You open the refrigerator up and it's all this glorious canine blood hanging in there, and they have a ton. So how they get that is they take dogs in for cleanings, routine care, and they ask them to donate blood. And so that's how their blood bank survives. So if you have a canine and you need to get their teeth clean, volunteer some blood as well. Resuscitation, we're gonna give them 20 mils per kilo. And we're also gonna give transexamic acid as long as we're within 3 hours, and I really hope that you're calling us within 3 hours so that we can get that. So we'll also do that. Traumatic amputation, please just stop the bleeding. That's basically the biggest thing you can do at that point. Put combat gauze on, put a tourniquet on, keep them warm, keep them comfortable, and don't try to salvage that limb because they're not gonna do anything with it. We cannot put that back on. It is just gonna be gone. So stop the bleeding and keep them under control. Go from there. Splinting. I feel like everybody kind of knows splinting. If we need to splint an arm or a limb, we're gonna splint anything from elbow down or from their knee down. We're not gonna go into their shoulder area, and we're not gonna go into their hip area. We're not gonna put anything on those particular spots. If they have a limb fracture, we wanna know, is it open or closed? If it's open and they're bleeding, we have to control the bleeding. Splinting is done basically to just stabilize that area and provide comfort. Please don't try to realign that or put the bones back in place because that's just gonna cause more damage. Could cause more damage. We talked about the knee. SAM splints, you guys, and pretty much everybody has these. But one SAM splint can be used, God forbid, on all 4 extremities of your canine. Or they can be used 1, 2, 3, 4 times. And so we've kind of recommended that everybody has this in case they have a limb fracture. If you do cut this to keep one in your kit, just make sure that you round the edges off like this because it will leave a sharp edge and you don't want that to rub on your canine. Gauze, padding, anything that you have that can make that joint more comfortable when you splint it, that's what you want to put on there. And like I said, don't try and squish it back together, just wrap it up, give it some comfort, and that's how you're going to do your splinting. Bandaging is kind of going to be the same way. What I want to point out, limb, paws, and tails, we pretty much got that. Throw some gauze on there, wrap it up, be good to go. Ears and eyes are a little bit different. If you get an ear laceration, they bleed. They bleed bad. And we're going to show you when you wrap that canine's ear and you fold it over, so you're going to fold it over, apply pressure, so you're going to put that ear flap on the top of their skull so that it has something to give pressure against, and then you're going to wrap it. The very next thing you're going to do is mark it with a marker, because what's the first thing when you go into the ED, what do? Someone's always got scissors, yes. And so the very first thing they do is they cut through that dressing that we've put on, and if we folded that ear over, they're cutting the ear. We don't want them to do that because the ear is already hurt. So make sure you let them know, or at least mark it so they know where that ear is at. That came from Dr. Jordan's shirt because he's seen it too many times in his ED. Eyes. We have a lot of search and rescue dogs. We have a lot of penetrating wounds. We have sticks that get in eyes. We have all things. If your canine gets something in one eye, don't remove it. Leave it there. But cover that other eye, because everything that this eye's doing at the same time. So you got to cover both of them so they can't see and can't move either one of those eyes to draw their attention to it, because if they go this way and this penetrating injury is here, it's going to cause more damage into that eye. So just wrap them both. Assessment. Do we want to break out and stop after this?
That was
Okay.
my thought. Easier.
So let's do an assessment, you guys, since we have 2 willing participants, and then we're not going to have death by PowerPoint and everybody's going to fall asleep because that's going to suck. And we'll go over assessment. So what we'll do is and Sam made a good point. I don't care if you do head to tail or tail to head, just make sure you do your assessment in the same direction every time so that you have something consistent to do. We're going to rake fur, we're going to check for injuries, we're going to look at their eyes, we're going to look at their nose, we're going to look at mouth, we're going to show you where to palpate a pulse, and we want to make sure that they're breathing. Are they conscious? Are they unconscious? Are they lifting that airway? What are they doing there? We're going to check the abdomen, and we're going to look for limb fractures as well. So we'll do a full assessment. So we can do one on that side. We can do one on this. One of the other way. 3.
I personally like to start at the head.
Me too.
Because you feel the nose. You know, first of all, you introduce yourself to the dog. I mean, you guys know the dog, you know. But make sure, they're not freaking out and you're surprising them. But I always start with them, check their eyes, check their nose, check their ears, and then you just quickly lift the gum and check capillary refill. So it's a quick, easy scoop as you're moving down, and then you start moving down the neck, and then the front limbs, come down the body, back limbs, tail. And then, like you talked about raking the fur, that's when you want to rake your fur backwards. Because if it's bleeding, the fur's gonna mat down, and you are not gonna find that bleed, it's just gonna be all matted. So when you rake it upwards, then you can see down to the skin, you can actually see where the wound is. And then once you find it, then that's where we talk about probing.
Yep.
And get it open, pack it, and then apply pressure.
And then always keep pressure on it.
Yeah.
And then you guys don't take dressings off. I think everybody knows that. Don't take the dressing off. Just keep piling it on if you have to. One, it gives us a good estimate of how much blood loss they've had, because we can look at those gauze pads and see how much they've lost. But also, if they're trying to develop a clot there and we pull that dressing off, we're just gonna make that bleed bigger, so. Okay, well, let's break them up and then we'll go over it real quick. Hi, Cole?
Yes. Hi.
How are you?
You're a girl. You're a girl right here.
Oh, no, wait.
Going on the floor,
Yeah.
table.
Well, is that music table?
I thought you said he's tall.
Are you friends? Are you friends with Rita and Swayze?
But you can buy nipples and they're a lot easier to do.
Okay,
You want him up?
if you can, yeah.
Cool. Get up, check your eyes, check your ears.
The best way to get a dog to shed is live in a bath, and that's what I did this morning.
Oh, yeah, I don't care. I have 2 giant dogs at my house.
And once it gets red.
So what I would do, you guys, is I'm just gonna like pan those and
So that's why you want to.
We'll start here with his face and his mouth.
Check their legs.
And so their noses should be
So
sort
talk
of
about-
moist, right?
And it just the chest, well,
Too old.
and then come back.
He's not too old, look at that pretty teeth.
How do you took the capillary refill?
So, oops,
This is where you check your
cap refill, super easy to see if you walk up to this guy and he's like panting, and as long as, when they open their mouth and they're panting, you can really see all that pink in there, right? You can see when their tongue rises and like the tongue bed, you can also see that. So I'm gonna stick my hand in that guy's mouth, he's pink, he looks good, right? And then a lot of these guys have dark pigment here. But all you're gonna do is you're gonna pinch that, or, push on that gum, whatever he's gonna let you do, but that's pretty fast, right? He
You'll
looks
feel
good.
guarded.
If they're all black in there and you can't see that, you're gonna look at tongue, you're gonna look at that raised, I know, this is like the worst, right? So as their tongue gets raised, when they're panting inside, you can see that.
You're such a good girl.
And I know, I just met you, I'm already sticking my hands in your mouth, right? His tongue, yeah, I get that all the time in my house too. You can also check in your eyes, if he would let you.
Oh, I feel my
down.
dog's
And obviously, he's awake enough that he's not gonna,
Fill pack, yeah,
let us
over
pull
the.
his eyelids down too much.
And you're just checking basically.
The pink, like you're just checking like the pink in their eyelid,
Now
kind
you
of
can
looking
check
glitter
your
on ours.
Oh, I can do that check off. And we just grab them right there, and just like breaks them, just like sit there, all just
On his mouth and nose, yeah. Yeah, he looks really good. And then, so then I'm gonna look in ears, make sure, like if they've had fall, if they've done anything, we're getting bloody ears right inside the ear,
And that's how
because
you're
that's gonna indicate that we have some people on the
Just
back.
Just working, are you gonna suction it out?
I think what I would do is I would cut down the floor, and then I would probably just rake to see if it's, yeah, to see if it's, yep. I wanna know, exactly, I wanna know, is it bleeding here, and I'm just seeing a lot of blood because it's superficial, or is it actually coming from inside and dripping out? And so I think I would clean it, dry it, see if I
So
can
for heat exhaustion.
like make that event happen again, whether that blood's gonna be coming out. And then, so we'll listen for his we'll take a listen to him. I would look at all of his experience here. And crank these guys and we will go over that. So take care and feel, because there is a trick there. You can feel that big bump like you do on any other. That's a piece of cake. It's so
Yeah, you
easy.
just pull their tongue out, slip it.
George, if you wanna show.
I know, it's super sucky up here. I didn't bring tea.
Okay, so the trick on the dress is, you don't do this to a normal dressing, it doesn't break off.
See, look.
Well, no,
right here, then,
The membrane gas, right, that's what I was gonna say.
So right there, as he swallows, you can really feel it and it's above it.
That's what I
They
figured.
were saying that
So what
dogs
you're gonna do is go
because
first
their trach is so long,
Right.
you can just back it in
Then
there.
you
And it's,
gauze on.
they're so big, they're so wide.
Electric razors and the.
Yeah, or just packing it.
Right, we have electric razors in our catering kits, do we need
We just have
them?
the manual ones.
That way,
Thank you, that was amazing.
If you're gonna crank these guys, are you gonna prefer sedated?
Oh, God, yeah.
or
Or they're unconscious and you don't have to. I mean, it would be like doing a rapid sequence intubation, you know, something like that. If they're unconscious, I'm just getting an airway. I don't care how we do it. And for the most part, when we intubate these guys, you're gonna tomahawk this stuff this time. And we'll go over that, but as the mouth is open like that, and you're coming at them with the blade, you're coming this way. So you're not going this way, and doing the blade, you're coming at them this way. Dr. McLean's like, the only reason we should be using that blade is if it's pitch black outside, and we can't see it.
So you should be able to just open up the
Every
whole
day
time.
in the morning.
Yep, you should be able to, and if you need to, if your partner wants to grab, you know, the top of their muzzle and someone grabs the tongue, you can just, it literally was like throwing darts in there, it's so easy.
So the odds of having one person at
Keeps
all
on
the
shoving
bases
his tongue back.
is gonna be great, so you just.
Don't throw up, Cole, don't throw up.
Oh, I didn't
That's
even
so
pour.
mean, Mom.
Yeah.
Yeah, you can't see it, I'm not gonna be able to let you see it.
She's like, thank you, Mom. No corn
If you were to
cobs.
hold her up like this, her organs line up.
So, yeah, sternum bone, that looks okay, and then if I'm gonna check a pulse
She'll talk
on you,
about chest.
we'll also be able to put
They're
EKG
certain
patches on,
demonstrated.
if this dog is critical, we'll put them
So
on
if
their
we have
blood
to meet
pads.
these girls once our piece, it goes boop, 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 boop.
It's like.
But other than that, her
Pulse
organs
too.
line up just like ours, which
On
means
the-
It's okay, honey.
you know.
So what we can do is if they're in the aircraft, I'm gonna take that little sticky pulse, or the little patch, and I'm gonna fold it like a little taco, and then I'm gonna drop it into their chip on the back.
Oh, I see.
So they're gonna, like through here,
Tourniquet,
is where you're gonna put it, you're gonna drop that little guy.
You guys heard of the Elias dressing, Israeli dressing?
Yeah.
The
So we
pulse is
carry
gonna be back
those.
here on their femoral.
These are the.
And for here, I would kind of check, okay, what does his back look like? What is his, what are his hips look like? Is his pelvis secure?
Yeah, you can feel his backbone.
Poor baby. But if, you know, if this is, if his pelvis is unstable, we're gonna wanna watch that. We're gonna carry him and be as careful as we can with him.
So
What are you
basic
gonna do,
actually.
like just by pushing here?
I'm just gonna rock that, yeah, it's not gonna be hard to find.
But we do
They'll
carry
have
these
a
as
lead
well.
blade.
And they're gonna be
The
dragging.
Elias dressing is very well this, and we carry these.
Their pulse is like way
Because it comes
up here in the
with,
femoral.
you have a find it easier to stand. This still allows us to go to standard combat. Like I said, it comes over.
Let's go towards his legs, so I would just grab this way.
Grab it and then
Come back.
So hard. Do you guys carry this?
Right?
You can always just use ice bandage and
the apical, you can feel their heart. But that really doesn't, your femoral's gonna tell you more about your perfusion, this is just gonna tell you
You
whether
can
they're not.
do.
Yeah. And then we'll show you when we do CPR, you're gonna be in the widest part of the chest doing CPR. It doesn't matter if you're on the left or right, because you're just gonna be recoiling in this
They were
chest.
telling us on these deep, on your chappy,
They have a normal
French poodle dogs, your round dogs, you're in the middle, but they can what you see.
And then the sat probe.
Ear on these guys, you wanna be in the lower, so right here.
So there's,
Yeah, so
so the
if,
best way to do that is figure out where their heart is.
I prefer the open muzzle if you have one, because that allows them to continue to pant. Is that the
Right at the elbow, so you can literally decompress it right there.
those are more like,
So we wanna think
Are you doing your same rate?
Yep.
You-
Yeah, and we'll go through all that, it's up there. And, you know, if you're in the field and you had to do pediatric doses, or if you had to do rescue meds, ACLS meds, it's pediatric doses for the most part. Every one of these guys knows how much their canine weighs. Every single one of them.
and his temperature usually runs below 300.
Right, so here you guys, we're not gonna sprint from here up, we're only gonna sprint from here down, because this is almost impossible to kind of immobilize that area. And then we're only gonna sprint from here down.
So I have a question about,
Yeah.
so like if you're just here, obviously when they walk, they bend.
Mhm.
Are you gonna splint in a position where it's bent and able to walk, or a position where it's
So if
straight?
this is fractured, I'm gonna support this whichever way it's fractured.
there's an artery in here.
So if it's fractured down this way, if it, I mean, whatever, because I just wanna put it into comfortable position for them, right, yeah.
Same thing as, everything's the same as the humans.
It is, so much of it is the
Pediatric
same.
doses.
Are you worried about
Pediatric
blood
doses.
loss in the pellet cavity? Do we
Yes.
wanna-
And
Do we
just get
wanna
a Sharpie and mark it.
find
So
that? So
The problem is you can't really bind those areas
Specific mark that they
without
like to
causing
see.
I
chest
just
rise and
outlined
fall
them here. I
issues
just outlined
because
the ear.
everything is kind of.
And most of them, I mean, I think they
like a dog terrier,
but sometimes.
sling type things.
And when we get in the aircraft, the very first thing, and Dr. McLean has no issues with us getting them sedated, getting them comfortable, getting them down. And then, and like I said, we're kind of getting ahead of ourselves, but we can do decompression. If we have that situation going
So
on,
we talk about.
if we need to do a chest tube,
Which that's just direct into the cavity.
it
It's not
is,
really
and you'll be
worried
able
about
to
finding
feel it.
something. Yeah,
So
finding
you'll be able to
something.
like
You can,
palpate it
you can use the
and
Samsung, you can, you
percuss it, and it will, you'll know exactly where it is. You just use it. Because their stomachs you look over. A lot of these dogs have their stomachs tacked
Great
down.
Danes have that
Both of
crazy,
mine,
right?
both of mine died from that.
Yeah. And the reason they die from it is from compression. So what happens is their gut flips over and it causes circulation problems all the way down. If they're dragging,
His was bad enough that it probably slowed down his heart and the back stopped his heart.
Do they start
He was
having
like,
It's moist.
I couldn't
color
put my arms
differences
around
down here or something like that?
color difference, not really, they get really big.
I see.
drooling, both of them are drooling.
Hi, Mark.
And you'll usually see their.
Both of them are drooling heavily and it was huge. Like my arm. He's
You
huge.
too.
They were
Doctor could do it.
We didn't get to that.
It was
As soon
just
as
so
we realized it was like 15 minutes. His
I'll
legs-
try and get on it, they'll try to
Yeah, his legs were in all
I
over.
texted her too, I'm like, we're 61, I don't know that.
Get it in there.
As an NG tube, maybe. But yeah, so you'll be able to feel ribs, you see any rib issues, we'll be able to look at their belly for that. We can do IOs and see it like a nice shoulder.
Oh, don't wag your tail. Oh, don't wag
If
your
you had
tail,
to
you're
do a
making
makeshift
mess.
muzzle, you guys would just this after. And you would, but again, if it's really bloody, it is. I know, that's super sucky. Mama, go like this, then you gotta go around. So this is gonna come up around here. And it would be, in that way, you're still
Then just
allowing them to
remember,
breathe,
come
maybe
down.
not necessarily up.
And then just
You
be
get
sure.
the whole good bite.
Just like one of our pouches that have all this stuff in it.
Bessie.
Yeah, just like a little
Bessie.
backpack.
And then we, you know, like if we need to bandage, you guys can bandage right.
I know, that is some stress shedding.
Just can't really. You're doing better than that. Or anything. And then if they had a penetrating wound up there, I like the SWAT team, but I don't want to wrap it around their chest. So I thought, it's not gonna, because it was so brief.
So penetrating wound, or let's say like gunshot. I'm sure you don't pack any catlings, right? Oh, you can?
Yep, so you're gonna rake, so this way, if he was injured and you're touching all of this is gonna get routed down, the blood is just gonna come straight out, you're not gonna know where the injury is. So what I do is. I actually go for a walk because now you can see. It's in the whole spot. It's a door like that. Just like he's doing that. And I'm gonna tunnel pack over there and now do
With water, no.
You can?
Yes.
You pack everything.
Because the children are gonna be
You're only gonna, I mean, you're gonna pack my needs that right? You're only gonna tunnel pack. Pack it.
You still pack it.
And then this Israeli or Elias dressing, based on what you call them, will carry these entertainment kits.
It's only 9 months.
That's good.
It's more like a diaper.
So I'm not gonna put this on their chest wall because this is gonna crap, right? That's gonna restrict you. I'm gonna put this on limbs, and I'm not gonna put it on their chest. If I need to put something on chest, I'm gonna put this type of stuff.
If you land
Say
in
he has
front
a
of that, that'll
penetrating
prevent
wound
them
here,
from
I'm gonna
getting
do
in
this, just directly over the injury, and then I'm gonna wrap
This thing
this.
is what we're
Piece this way. You just keep wrapping it and get it, and then I'm yeah, if you stood this guy up on his side next to us, their anatomy, internal anatomy is supposed to their stomach is this, all of this is just a hot mess. If we get a GI wound just like anybody else, that's what it is. We'll talk about chest decompression, we can do decompression on these guys. If I did one on one side, I'd have to do the other side. So if I'm gonna stay late on scene, if I'm gonna decompress this side, I'll load them in the aircraft and then decompress that side.
Same deal size.
14 gauge.
Long one after doing
Yeah,
what to do.
you're just, I just use the calculation times your calf just like anything else, yep. Yep, and you just, get it, and we'll show you where to get it.
More or less just.
In the age that are longer. Yeah. I think you're gonna go as soon as you, I mean, if you get that air, you're gonna stop right there. Especially I'm just gonna stop and I'm gonna pull that guy out. If I'm doing a belly blow, I'm gonna leave that. And then as they start to re-expand and I see that problem coming back, I'm gonna re-tap.
That's something that we're gonna do. That's something we're gonna wait till LifeFlight does. Blow the pill quick. Okay, so that's
Because I have to get to them. I mean, that is a so that's why, and so we're gonna also take the ball, I mean, that's gonna be you guys gotta handle that too. Same thing, if you find these injuries on the range, you pressure on it, you pack it, let me know where it's at. Surgery as fast as you can. And then the belly, same thing, if you have a belly problem.
I think our big challenge ahead of us is controlling the emotional side. And it's actually better when I'm dealing with control on that factor. Even if it was my own doctor, I mean, still,
Humans would bite you for
so I think that's our big challenge ahead, is appropriately handling that.
recommend it or prefer it.
And I think the safest thing is if they
Especially
have
when you're
Yes.
creating one.
We have a slide. So we'll go through what people have kind of recommended. I have,
I know you gotta order most of our stuff, so.
well,
But when it's
and
them,
I ordered
usually
these
when
really cute.
it's a white dog,
I'm the guy that orders.
I know.
they are.
Yeah, see?
So
I know a guy that
I ordered some off Amazon, and she'll show me a picture of it. But I think they're too small, because I wanted something compact that the dog could actually carry. But
But if the dog's in
wouldn't
it,
it be a little too small? Let's see if I can find it.
So 9 times out of 10, what a lot of the handlers.
Because what I could actually fit in there was a combat gauze,
we do
live
stay with
stressing,
them, but,
and I think one of these, and that was, that's all I could fit in there. So we got pictures
Oh, yeah.
because we had some people, I was saying when people come out for work trying to help, we had the school donate a ton of lights and combat gauzes to us.
If you decide to run it, after
So that's the stuff we're gonna be using to do our own bike. And hopefully we can get everyone at least a maybe.
they will buy it, but not
Well, I was just thinking like, you know,
I know the line.
Depends on if they have
bags are like $12, they're about that big. Just have that in it.
So this one, someone else had this foundation one that they've got, and has a hemostat on the outside, which is kind of cool. And it had two 14 gauge needles, had the combat gauze, it had a SWAT T underneath, thermometer, which is a SWAT T. Anyway, so they just kind of
We'll go over all of this, you
but
guys.
this was really fast, and it's still, so we're trying to find those.
So at what point does it cross the line for us? Is it when it's medication administration that we have to like buy your?
Or if you think it's time
Fill that
critical.
entire cavity up.
That would
Well, I
be,
meant as far as like doing stuff, like if we're waiting for you guys to get there and they've got a new one we can do this year.
As far as restraints, you guys, so the city
Within our, I'm gonna say
however these
scope.
guys wanna do it, I mean, they know how to do it.
so we're practicing more of an area.
Right, well, that's, I mean, would that constitute as us
I
practicing?
think if it's like say an IV gets this position, that's, you know what I mean, you're gonna do it, especially right, you know what I mean, like you don't have time. And we'll kind of go over how to do those procedures. I think it's important that you guys, if you have this, if you're comfortable, just do it.
They fly them too, like,
You always regret that you didn't. I knew how to do it and I didn't do it because I was afraid of.
Yeah, I mean,
I would just do needle IV access and spikes because it's gonna be better.
no, and just know that if you're going to secure it, try to use that same technique where you take an IV in, you with the bird,
And it's
so
just
that
that nice, beautiful.
and then just wrap the shit out of it. You know,
save a little life,
yeah,
easy
frameless per
or.
kid, for sure.
And then you can just start.
Actually, most everything is pediatric, like all the med
And we'll
dosing,
go over the all the
Yeah, I was gonna say, yeah, with PM, yeah, that's great.
just go over the Yeah, so, yeah, I mean, if you're waiting for us, do what you need to do for us to get there.
Well, we're fortunate enough.
I don't even let you go.
I mean, I call it med hospital. And
So if this canine is.
That mouth
literally, just up the street, literally.
We don't give
Yeah, just you take the street, you're gonna just run right into it.
So the key thing is just know where your resources are.
We have to look.
In this area, there's a Rockford, Sunset, and All West are the only 24 hours critical care, and they are the only ones that have bloods. And they have surgical services, they have an MRI, they have a CAT scan. they have all
Maybe we get that for you guys.
So just know what your resources are.
We have to actually.
Because that, with Maya, they went to the nearest veterinary hospital and they didn't have resources. And then she died.
It'd be nice for us
Yeah.
just to have
I think we'll just get a dog stuff.
So it's just a matter of that's
The problem is with,
if you can get there, you go faster than us, you know, you're close, don't wait for us.
So we'd have to call him.
so that's the part that we, that was the
Especially
part
SWAT
that was
stuff,
super
we're
sticky
like,
for us.
we have that, I'm gonna call it discretionary time, but we're trying to get it out on its own. It's perfect for us to, you guys to come to us.
Right.
Because now we're also waiting on an ambulance. We have
And they don't have any.
She gave me good advice, she thought I was supposed to stand in the middle
What,
of this.
Hey, Mark.
You're supposed to lay down.
I'm making the eggs, I'm making the eggs.
as soon as we land on
Will
the
told
ground
me
in
LZ
the
Will,
valley,
he might have been 500
and, you know, we're still gonna be rendering agents.
So if we're gonna
Just to
get,
keep the veterinary board off our
okay.
backs.
if we're gonna get direction from veterinary, do you guys, or do you want us calling that?
And they can dispatch.
Okay.
Because it almost works
All right.
like you guys directly.
We're waiting to get online with it.
Yeah, I gotta go to the bathroom.
I'm gonna set up my
Just get online.
So you wanna follow up? Yeah, you wanna start?
Bathroom's right there, I'm doing it, just right through that door and we just.
Okay, we'll keep going with this, you guys.
I've got
You guys ready to keep going?
Yep. Okay, really quick, airway obstruction. Of course, this is something that you guys will have to act immediately on. And I actually have a video showing how you can actually dislodge these. Okay, I might have to like, oh, didn't start. Oh, perfect, here we go. Okay, so you're gonna watch this. This dog came in with a ball obstructing his airway. And you're gonna see what you have to do. Let me go back one really quick. You actually have to get under the mandible, and you'll actually see the ball here, and you have to get under it. And this is with the dog being supine, being able to like sit upright, ventral. And then you'll have to like push that ball up. And you have to, it takes a lot of force, but you have to get under their mandible and literally push that up, and then the ball will pop out. The video I have is of one that the dog came in unconscious. But you'll see the amount of force it takes to actually get that ball to dislodge. You can see she's pushing up on under the neck, getting the ball, and then you'll just watch. And once the mandible gets in the mandible area, the mandible will actually pop open, and then it'll just pop right out. So there's two dogs that come in. You saw the second one. I don't know if you saw the second video. You can go back and come back. It's pretty quick. You can see like she's gonna get in, it takes all her body weight to get under that. Okay, the girl with the ponytail's in a knowing position, so. There you go, one ball pops out, and then this other one actually is a little bit of a better view, where you can see them pushing that out. So that's how you'd be able to dislodge if you get an obstruction.
You wanna come on that side?
Sure. Okay, so we're talking about airway and breathing. So first of all, of course, clear the airway. Is the breathing labored or not? So you're gonna be able to look at them, and when these working dogs are working, they're panting, you know what their normal pant looks like. When they start getting where it's uncontrolled or they stop having saliva, then you know they're in trouble. So go ahead and look to see if it's labored, see are they short of breath. Make sure that you have equal rise on both sides of their chest as you're assessing breathing. Allow them to pant, like I talked about over here. The open muzzles I really like because that allows them to actually pant. And that is their stress response. It also is the way they're going to cool themselves down. And then whatever you do, just keep them in the position that they're most comfortable and help ease that anxiety. So cardiac arrest, these dogs are healthy dogs. They're not going to have a cardiac event that causes it. There's going to be another etiology that's causing this, and we want to reverse whatever the cause is. So, but in the meantime, you will start CPR. We'll show some pictures. You'll have them lay on their side. Go ahead and do compressions, and it's the same as with adults. It's 100 to 120, 2 breaths every cycle. I'm trying to think, every 30,
3 to 5.
3 to 5. And then just know that the goal is 15 minutes or less. After 15 minutes, the chances of us getting them back is really, really slim. And of course, once CPR started, the first thing you want to do is dispatch LifeFlight, see if we can give you the time that you need. So talk about here. So here is the compressions: 100 to 120, 30 compressions, 2 breaths for every 2-minute cycles. Mouth to snout. Go ahead and do that for breathing. Try to avoid compressions as possible. 5 out.
They're gonna lift it about 5.
Oh, okay. Sustain those compressions. Don't worry about their ribs. Their rib cage is really pliable, and you'll feel the give. But just go ahead and do it. Don't be concerned, like you should talk about breaking ribs or compressions. And I'm going to show you a picture where we want you to do compressions. So make sure they're in the lateral recovery position. Place hands over the widest part of their chest. And that's a pretty good marker. The other thing to do is if you bring their front arm up and then where the elbow hits, that's right where their heart aligns. So that's your secondary conferment place where you want your hands to be. And it doesn't matter which side, just pick a side. Opiate overdosing, it's the pet poison control, right? Dr. Laura recommends.
She likes the bottom one.
Yeah, she likes this one, but these are numbers if you need to call for, these dogs get into anything and everything. And it's a good chance that they can succumb to an overdose. Just know that pet poison control, if you call and let them know that they are operational working dogs, they will waive the fee for the call. Okay, drug dogs, handlers, most, I think, do you guys have drug dogs here? Do you carry Narcan with you?
Yeah.
Yeah, you carry Narcan, okay, perfect. Do you do intranasal or do you do IM? Intranasal. Yeah. Okay, perfect. So we also have Narcan, we will do the intramuscular IV, but for in the meantime, the intranasal I think is the best. Trying to get through all the fur and everything else, the needle's not long enough on the ones you would give IM. Okay, heat illness, and this is kind of, as we have been talking about, what are the most common injuries, this is one that we think we're actually gonna see when these search and rescue dogs. Just know, like mild heat stress, their core temperature will be 105 to 106. Do you guys all know what your dog's core temperatures run when they're working?
Yeah, mine's 104, 105.
Okay, so you'll know once they start exceeding that point. You'll recognize the behavior first. You'll recognize that their saliva starts drying. They're now panting uncontrollably. They won't be drooling. The nose will be dry, and then the mucous membrane will turn bright red, and that's when you know you're in trouble. Up to that point, they say, try to, if you see them, they start getting in mild distress, take them out of the situation if possible. Soak them all the way down to their skin and fur with cool water, not ice cold water, and put a fan on them, put them in the shade, put them somewhere where there might be a breeze. And then for moderate heat exhaustion, then you're no longer compensating. That's when you want to start an IV and you want to start giving crystalloids and just give them that 20 ml per kilo. And you all know your dog's kilos and weight, so just give the 20 per kilo. Once you start getting severe where their temp is greater than 100, they're now mentally altered, they're weak, they may be vomiting, diarrhea. You're now past that point of probably getting the turnaround. So continue to do what you do, but then call LifeFlight and we can come hopefully get you out faster. We do have, it's not quite officially but we do have a hoist harness that we are now waiting for FAA approval, but the goal is to be able to hoist the dog out if it's in a situation that we can't access easily, or for our search and rescue dogs, being able to insert them versus them having to hike up the mountain to that place. We're going to hopefully take off some of that workload from them by being able to insert the dog and the handler. And just know, whenever these dogs are injured, the handler goes with them. That's a given. God forbid the handler is injured and then we're calling another aircraft, then we ask that one of the co-workers who knows that dog well go with the dog. That dog needs to have someone that they're familiar with in all these transports. So we talked about the heat illness, we kind of went through this already. Remove the canine from the source of heat, discontinue exercise, soak the hair to the skin, cool with fans or air conditioning, give them some cool water to drink, IV fluids. Here it says 3 to 5, just, you know what, if they're not compensating, they're in shock, just go for the 20. And then once the temp gets down to where they are normal, go ahead and discontinue the cooling, and then of course call for help if needed.
I have a trick to do it. Don't just pour the water over the top, but
Okay.
get a bucket, get towels, and lay the towels on the dog.
Oh, okay.
It works so much better and you
Okay.
use a lot less water.
Oh, nice. Okay, that's good, thank you. Snake bites.
Right.
This is the thing. Darby is
Terrified of snakes.
I know.
Hate them.
So we used to say, bring the snake with you so we can identify it. She's like, oh, hell no.
No, don't bring that in my aircraft. I'm not getting in it.
Take a picture of the snake so we can hopefully identify it.
Snakes on a helicopter.
I know. She's like, hell no. So,
Wasn't there a movie they made like?
snakes on a plane.
Yeah.
So yeah, take a picture of it if possible. The only thing we can do is give them anti-venom, so we just need to give them the time and speed to get them where they need to get the anti-venom. Okay, anaphylaxis, again, allow for the position of comfort. Manage their airway. Of course, we can do epi. You guys can do sub-Q epi if you needed to. I am. Of course, these are the drugs that we carry if you need us. Epinephrine, we have normal saline, we have LR, we also have Buterol and Benadryl that we can give if needed for anaphylaxis. Pain control, do not give any canine ibuprofen or Tylenol. We do carry fentanyl, and that tends to be the drug of choice that Dr. Laura McLean has recommended. Ketamine is highly, highly discouraged. It causes this dissociative thing in the canines, and they will go insane. You know, with a human, we can give Versed or something to kind of blunt that, so they don't have this crazy wildlife dream. With canines, you can't do that. So they end up being hurt, they're panicking, and you give them ketamine, and they will literally chew through anything. They've chewed through the ET tubes, they've chewed through muzzles. It makes them crazy. So do not give ketamine. You can give morphine, you can give fentanyl.
What do you usually use to sedate them?
We use morphine, fentanyl. If we have to intubate, we will paralyze them with rocuronium, and then we'll use propofol to keep them down. And these dogs have hypermetabolic state, so they burn through it super, super fast. So you give, and like I think I was talking to you about, the standard dosing for these dogs is pediatric dosing. So you give, whatever the dose would be, 0.1 per kilo that you would give. But just have the next dose drawn up, ready to go, because they're gonna burn through it super fast. So IV access, we kind of went through how to be able to stabilize, access an IV. The cephalic vein in the forearm is the best. The back one is great if they're standing, but once they sit down, it disappears. So this one is usually the best if you can access the front one. We can also do an IO as well, same landmarks as on an adult, and you will feel the nice flat spot where you would want to insert that. ET tubes. So we kind of talked about, it has to do with the length. And holding up to this, you would see where the hub, basically, here, and then this has to go to the first rib. So depending on the size of the dog, like this, your dog would absolutely need this size. Because there's a lot of dead space between the airway and to the first rib. But that's where the cricoid, is right down here, so that's where you would go. Not cricoid.
Just where their bronchus is, with
I
it
know, what
splits
is
off.
it? Carina. Jesus,
Yeah.
that's what I'm thinking. I'm like, no,
What's
it's a
that
cricoid.
word?
You can actually cric these dogs, and it's the same way you would do an adult and a human, just FYI. Same landmarks, everything. Okay, so we talked about if, you had to needle decompress. On these dogs, what you do is you kind of get your hands on their chest. You'll get your pinky finger kind of where their shoulder blade comes back here, and then also where the hip begins, and you'll kind of put your hands together like this.
Last rib.
Last rib. Yeah.
So they're gonna have like 13, and you're gonna put that last one here, and then you're gonna walk your way over this way.
And that's where you're gonna needle decompress. Now remember, their sternum is fenestrated, so air communicates left and right. So once you needle decompress one side, you gotta flip them over, needle decompress the other side. And then we'll go on to that. And then that's, usually we'll do the immediate needle decompression, and then we can place a chest tube if needed, but in general, we'll probably just leave the needle catheterizations in and put them back in. Okay, gastric distension and bloat. Same thing, these dogs don't have much time when this happens. You guys are all familiar with bloat, where the stomach actually flips. They can die within 15 to 20 minutes. What happens is the stomach flips, it cuts off all circulation from that point down. And they'll be vomiting immediately. You'll see it. You'll see the gastric distension immediately. You'll be able to see which side the stomach is flipped. And whatever side that is, we put them down, and you would tap it, get the nice tympanic sound, and just go ahead and needle it and decompress, and you'll get the god-awful smell with it. But that buys them the time, hopefully relieves the pressure, because that compartment syndrome is killing the dog. And then we can, of course, come back. We can also do this as well. We've been trained, and then get them to a surgical center quick.
You guys, and this is pretty and all in like the real surgical world, but what I'm gonna do is I'm gonna throw some freaking alcohol in that. I'm gonna tap that as soon as I can. I'm not gonna get my razor out and shave all that in a nice pretty square. I'm gonna pour it on, clean it up, and tap their belly.
Just tap it. We do carry antibiotics, so if we were to treat for any kind of chest tube or for bloat, we will automatically start antibiotics on the dogs. Okay, so burn management again. Just give 20 mLs per kilo.
Yeah.
Trying to calculate everything, no, just give 20 mLs per kilo. Just give the dogs the fluid they need. And then here's the individual kits that we were talking about. We kind of made up a mock one, it's way too small. So these are things that people have said that they would like in there. That's a lot of stuff to put in a very small kit, because you want the kit small enough that you can carry it or it can be on your dog as well. But trauma scissors, thermometer, a card with canine information with a weight, any kind of allergies, anything at all. Field muzzle, forceps to remove, thorns, porcupines, SWAT tee, combat gauze, regular gauze, elastic wrap, because we have the Elias dressing or the Israeli dressing, but even just an ace bandage is good enough with the gauze and kind of the acrylic stuff. Coban works really good. Chest seal for a pneumothorax, and of course a skin stapler if you got a laceration or something that you could just staple real quick. So these are kind of the recommendations. You guys think of things you want, please let us know, because we're hoping to get these built soon. So, do you guys have a current kit for your canine? Kind of, sort of?
Yes.
Okay.
Yeah.
Yeah, I know. So that's kind of what we're finding out. So we're hoping to get started on these soon, that we can get those distributed. Just know a lot of the things that we carry for humans you can use on the canine. Be careful with the tourniquets. Those are awfully narrow and they will damage the vascular underneath. Plus it's really hard because of the cone-shaped limbs. Go ahead, use Coban, use an ace bandage. Do whatever you would normally do to try to stop that, but try to avoid the regular tourniquets.
So on tourniquets, when you're applying that to the dog, is that the same as humans, just kind of as high as you can, or are you just going above the injury a little bit for them?
So Gabe and Kate talked to us a little bit about that. They got some training through FEMA, and it just put it on wherever. It doesn't matter how high you go. It doesn't, as long as you're over the top, above the wound, that's where you want to be.
Yeah.
And then I'm still going to check, are they super cold, or are we getting a circulation problem? More than anything, we want to stop the bleeding. So that is the very most important thing. But I also don't want their limb to go cold. If we're coming from Cedar or St. George to Vegas, that's a 40-minute flight. We could lose the limb without perfusion during that time. So we're going to watch that limb pretty close. And when you tip their paw over and you're looking in their paw pad, you can see the color in their paw pad. If they're not totally pigmented, black, if they have some pink or some color that you can see between those paw pads, you can see that they're still perfusing that limb enough. So that's what I would do, is just tip that paw over and keep a look on it. And make sure it's not freezing cold. Yeah.
I had a question about a chest seal.
Yeah.
Even with the razor, are you able to get enough hair off of there to be able to have a chest seal placed?
No.
That's
We
a-
would most likely just needle decompress and leave a needle on.
That's what I was
With
curious
that, and we have
about.
little, I don't know what you guys use for needle decompression, but we have a little mini Heimlich valve that we can slap on that. And that's kind of what we do for needle decompression.
The last teaching we were told, you guys, so Sam, this medical company, has made a canine chest tube bandage, and it's got more of like a gelatinous gauze on it, or I don't know what it's, anyway, they said that you could put that on with the hair because it forms a seal around it even over the top of the hair. It is going to hurt like crazy when we take it off, but let's hope we've got them sedated and they're happy campers at that point.
And I think Gabe even recommended getting duct tape.
Yeah,
'Cause that
in
will
a
work.
pinch.
In a pinch, use duct tape.
Pull it off 3 times,
And just know, for police officers, you can totally carry your firearm with you on the aircraft, but no compressed gas, because our aircrafts are not pressurized, and those can explode, and then
we're all going to need medical attention.
I know. That's when the pilot cracks the door and bells,
I'm out.
So yeah, just no compressed gas, but you can bring your firearms, and you don't have to unload them. Nothing. That's fine. For our hunters in the backcountry that we pick up, we unload the guns, we keep them separate to get, you know what I mean, in a way, so. But in general, police officers can maintain their weapons. And that is it. Okay, questions for us so far? Okay, so we'll go out there with the dogs. We're gonna do what we call cold loading. We'll practice loading them into the aircraft without the blades actually spinning. We'll show you where you need to sit, where we're gonna secure the dog. We have an anchor that we actually secure the dogs to the aircraft so that, because what happens is when we go to pop the door, the dogs think they're there to work and they wanna jump. So we keep them anchored so that we don't have a dog jumping out of an aircraft. So what we'll do is we'll have you practice doing that while the aircraft is not running, and then once it's, then we're gonna fire it up. We're gonna practice loading you in with a hot helicopter. We'll lift, take a quick lap, come back down, have you hot offload, and then we'll unload another person with their canine. The dogs have incredible memories, and the more exposure we get into a running aircraft, that's one less anxiety for them when they're actually injured. So we want to get them the exposure if possible. So, okay, that's it. We'll go outside.
You be my dog?
If you guys wanna ride.
I wanna ride.
Me?
You weigh as much as my dog did.
Do you know how to turn the recording on?
Yeah, there's an out button on there. Me?
Yep.
It just says, yeah.